Good evening. The latest on the prevention and fight against HIV/AIDS with Dr. Michael Harbour. Looking through our video archives, we come across this segment on the San Jose AIDS Memorial Grove. HIV/AIDS in the trans community. A talk with Aaron Armstrong of Trans Thrive. Ending the stigma of HIV in the community by telling and witnessing our stories. The Banyan Tree Project's Taking Root, Our Stories, Our Community. And our annual Christmas video on this special World AIDS Day edition of Outlook Video. Welcome to the World AIDS Day edition of Outlook Video, your nationally recognized, award-winning news magazine for LGBT communities. I'm Christine Hancock, and season's greeting to you all for this month of December.
Happy holidays, everyone, and I'm Tom Smith. On this special edition of the program, we focus attention on AIDS-related topics for World AIDS Day. The World Health Organization established December 1st as World AIDS Day in 1988 as an opportunity for people worldwide to unite in the fight against HIV, show their support for people living with HIV, and to commemorate people who have died. This year's theme is Working Together for an AIDS-Free Generation.
This month, Dr. Michael Harbour, U.S. Director of Medical Affairs for HIV at Merck, talks with Tom on the continuing prevention and fight against AIDS.
Transgender communities in the United States are among the groups at highest risk for HIV infection. Aaron Armstrong, Program Coordinator of Trans Thrive from the Asian and Pacific Islander Wellness Center, talks with Jay Raley later in the last half hour about HIV/AIDS in the trans community and the Center's services for transgender people.
Also from the Asian and Pacific Islander Wellness Center is the Banyan Tree Project, a national social marketing campaign that educates how HIV/AIDS and HIV/AIDS related stigma affect Asian and Pacific Islanders through speakers panels, conferences, television ads, news articles, and many other methods. One of these methods is Taking Root, Our Stories, Our Community, an initiative that puts the power to end HIV stigma back in the hands of the community. Through short videos, Taking Root reveals the storyteller in each of us. By telling and witnessing our stories, we overcome silence and shame. And we will show some of those videos later in the program.
The Center for Living with Dying program provides emotional support to adults and children facing life-threatening illness or the trauma of having a loved one die. The center also provides crisis intervention services and broad-based educational programs on grief and loss. Jay Raley visits the center and talks with Janet Childs later in this half hour.
And continuing our annual tradition, we premiere this year's official Outlook Video Christmas video. Last year, the five of us were in a parody of A Christmas Carol. Do you know what it's going to be this year, Tom?
You know, I don't know. I don't have any idea. But I hear it's going to be black and white. We'll just have to wait for it. So fasten your seatbelts. But first, Dr. Michael Harbour.
I'm Freddie Smith, and you're watching Outlook Video.
This year marks the 31st year of HIV/AIDS, and currently 1.1 million people are living with HIV in the United States. Each year, approximately 50,000 Americans become newly infected with HIV. Dr. Michael Harbour, who is the U.S. Director of Medical Affairs for HIV at Merck, is here to tell us the latest regarding the prevention and the fight against HIV/AIDS. Dr. Harbour, thank you for taking the time to come to our program.
My pleasure to be here.
So let's get right to it. What progress is there in this fight? 31 years and those statistics, when I hear that, you can get pretty downcast.
Yeah, well, actually, this year has been a great year for progress. Just this past summer, oral home HIV testing was approved. So there's a brand called Aura Quick, which people can just buy over the counter in pharmacies. It's about $40, and it's an oral swab test in which somebody can do home HIV testing. Currently, about 20% of people who are infected do not know that they're infected, yet they are responsible probably for about 50% of all new infections in the United States. And so people can go home and take their test.
So it's inexpensive, and you don't have to have access to a doctor or insurance to get the test and find out your status.
There's an 800 number that you can call for support should you have a positive test or need counseling after the results.
Also, I heard about a pill called the Quad, why that is better than a tripla, for example.
Okay, so Quad, a tripla, another drug called Complera, are all single tablet regimens. It's all HIV cocktail medications put together in one tablet once per day. There's nothing different about the quad in terms of its efficacy. All of the single tablet regimens work quite well. Each has its own unique side effects, but it's just one more drug in the armamentarium with which to treat patients.
Okay, I understand Truvada has been talked about and been in the news lately as a prophylaxis. Can you talk about that and explain how you would use that?
So prophylaxis is a term for prevention, and we can prevent HIV infection either after an exposure, so after a sexual exposure or an occupational exposure at work, or before an exposure might occur. So what you've heard about is pre-exposure prophylaxis or PrEP. What that PrEP is patients can actually take one of the approved drugs for HIV on a daily basis to help prevent the acquisition of HIV. It's quite important that patients take this daily.
So you have to remember to take it daily?
You have to take it daily.
Okay.
It's not just an episodic type of therapy. The compliance is necessary in order to have the good preventive outcome. And it's usually mostly reserved for patients who are at the highest risk for HIV acquisition, those whose sexual practices put them at risk, or somebody who has a regular ongoing sexual partner who has HIV.
So quickly, if we could talk about the Affordable Care Act now that President Obama has secured his second term.
So the Affordable Care Act
forward to?
Is here to stay. And for patients with HIV specifically, it's going to allow more people to be covered in general. So there's going to be an expansion of Medicaid throughout all the states, and Medicaid is a program for poor people. We will also have insurance exchanges set up, so patients who don't have insurance can potentially go buy it. Those who have pre-existing illnesses cannot be canceled by their insurance.
That's great.
And then finally, the Ryan White Act, which is the payer of last resort for those who don't have any access to HIV, will still be in place, although it might be modified a bit under the Affordable Care Act.
We want to thank you, Michael, for coming on the show. For more information regarding the testing and treatment of HIV/AIDS, please contact the PACE Clinic at the Santa Clara Valley Medical Center at 408-885-5935. Coming up next from the archives, the San Jose AIDS Memorial Grove. You're watching Outlook Video.